Life is about shedding the darkness and embracing the light of knowledge. So let's get together and awaken our minds. Hello, welcome to the video series of Awakening the Mind. My name is Dr. Akash Ahuja and I'm a psychiatrist here in Los Angeles, California. And I did my medical school from Maulana Azad Medical College in New Delhi, India, and did my residency from Hennepin Regents Psychiatry Program in Minneapolis, Minnesota, the state of United States. Today, the topic we are going to discuss has huge implications, affects so many people and mostly elderly. Elderly people who have done so much well in their lives. They have done a fantastic, resourceful life, went to work, took care of their families, contributed towards the society and the country. And one of the worst things which we can imagine is seeing them struggling. And not only just struggling, but struggling because they don't even remember the name of their spouses, the date of their birth, the date of their anniversary. They cannot even tell that this is a bottle. They don't know how to say that. Sometimes they cannot even feed themselves, go to the bathroom by themselves, and just become dependent on the caregivers. This is such a deadly disease, and yes, I'm talking about dementia. Dementia affects so many people across the globe, and yet many a times people have very little knowledge about this illness. So let's talk about dementia. I've prepared some slides for that, which I'll be referring to. So we'll be discussing dementia. So guys, what is dementia again? Dementia is the loss of memory. The people will be asking same questions again and again, and which sometimes we feel frustrated about because we just don't know that it's not like they're not paying attention to us, but they just cannot because this thing, dementia, is creeping in. They become lost in familiar surroundings. I mean, the neighborhood they grew up in, the neighborhood they have spent 40-50 years, they cannot navigate now. They cannot drive the cars, they get lost because they just don't know the directions. They forget the important dates, events, telephone numbers. They neglect their personal safety. It's like they just, as I said, cannot use the restroom by themselves at times. They cannot feed themselves. They cannot cook for themselves. They become very much dependent on other people, which takes a toll on their confidence a lot. So friends, there are many kinds of dementias, but the most important type, the type which affects the most people across the globe, is known as Alzheimer's. Alzheimer's disease or Alzheimer's dementia. So let's talk a little bit about what happens in Alzheimer's, and then we'll go into what causes Alzheimer's. People become not able to learn new things. For example, they need to learn any new process or new concept. It's almost impossible for them to learn that. In fact, if the disease becomes worse, they cannot even recall what they have learned in past. It becomes very difficult for them to name people and persons and objects. They will know that, okay, this is my brother or sister at times, but they will not remember their names. They might have difficulty identifying persons. When the disease gets worse, they will know maybe that they know this person, but they will not remember or understand the concept that this is my brother, and that is devastating. And they understand that they are struggling with that. It's not like they are not aware of that. Decrease in the motor skills. What that means is very small tasks, like for example combing your hair or buttoning or unbuttoning a shirt. They just cannot do that. It's not like they're being lazy, it's just that their brain stops functioning in that particular way and they just cannot handle it. They have difficulty in planning things. Like simple tasks, like for example going to a neighbor's house. They don't know how to plan it. They don't know that they have to get out of the bed, wear the socks, the shoes, go to the door, open the door, go out and go and meet their friend. They cannot plan this simple task also, when the disease becomes bad. So let's discuss what causes Alzheimer's. Well, some of the factors which affect Alzheimer's is age. As we grow up in age, the chances of Alzheimer increase. And the research shows that people in the age group of 65 to 75, 7 to 10% of people might develop some symptoms of Alzheimer's. And when they reach 85, that's a great news, but the chances of getting Alzheimer actually becomes like 50%. That's 1 out of 2 people. Family history is very important. If somebody in the family has Alzheimer's, like one parent or 2 parents, then it increases the chance, it increases the susceptibility of the child to develop Alzheimer's when he gets older. And sometimes, let's say if a father got the Alzheimer's at the age of 79, the child might get Alzheimer's at the age of 73. So that can certainly be possible. Now these things happen because in our brain lobes there is a proteinaceous material known as neurofibrillary tangles, and that develops. We still don't know exactly why it does, but we know that people who have this gene, ApoE gene, they are more susceptible to have those tangles in the brain and develop Alzheimer's disease. Friends, now let's talk about the treatment of Alzheimer's. Well, the sad answer is that there is none. I mean, we all will think that a lot of research and science has been working on Alzheimer's, and it's such a devastating disease, so we must have some treatment. There is none. They are trying to create a vaccine to cure Alzheimer's, but so far we haven't been very successful. There are few medications though available which can slow down the progression of the disease at least, and I will name 2 of them. They are donepezil and memantine. To learn more about them, we should understand that there are many neurochemicals in our brain, and 2 of the chemicals do affect the memory. One is acetylcholine, which is good for the memory, and one is glutamate, which is bad for the memory cells. It actually kills the memory cells. So what donepezil does is that it stops the breaking of acetylcholine. So it increases the concentration of acetylcholine so that people who are getting the symptoms of Alzheimer, it slows down the progression at least. And then similar thing is memantine. It decreases the glutamate. Glutamate actually kills the memory cells, so it decreases the glutamate so the memory cells don't get killed that quickly. Some studies have shown that vitamin E also has some preservative effect on Alzheimer's. But as I said, there has not been any cure for Alzheimer's. Friends, Alzheimer's is such a deadly disease, as we have learned, and but by knowing more about it, knowing how to deal with it, knowing how to diagnose it, and knowing that a doctor is very important in terms of people having Alzheimer's, we can at least make sure that people don't live more miserable life than they have to. We can help our seniors, and we can give them the rich life what they always deserve to have. Thank you for watching this video.